While we get everyone settled, I'm going to launch a quick poll. If you have a second, you can just answer a quick question. I'll give Richard a little idea of to who is attending today. And then we'll jump right in. Give it one more minute. So I see people still entering the room. All right. Thanks for all those who answered the poll. Share the results, get a sense of what's going on here today. And let's get started. Richard, welcome everyone to the What You Don't Know About Medicare Can Hurt You webinar. This will be a painless webinar, and if you stay for the full time, it should be educational and hopefully enlightening. When this is over, you will be informed and less confused about the Medicare process. We are recording. Please add your questions to the Q&A section and we'll address them during the webinar. And we, of course, will email everyone a link to the recording and any relevant resources that come up during the event. And anyone could email the CoverRight team at hello@coverright.com at any time. About a month ago, we ran a webinar where we covered and hopefully clarified some of the Medicare madness that people may have experienced. That recording is available in our Learning Center, which is learning.coverright.com. And next month, we will have another webinar, which is titled Time is Not on Your Side, How to Make an Informed Medicare Decision. So let's jump into introductions. My name is Joseph. I head up marketing for CoverRight. I'm excited to host you today. We have a lot of information to cover. And I'd like to welcome Richard Chan, who is the CEO and co-founder of CoverRight. He's a content writer, a licensed insurance agent, focused on Medicare. He is based in New York and is passionate about empowering consumers to take control of their health and finances. Richard has extensive experience working in financial services and related industries. Rich, the floor is yours.
Thanks, Joseph. Hi, everyone. Like Joseph said, my name is Richard. I'm the co-founder and CEO of CoverRight. Firstly, thank you everyone again for joining our webinar. We've got a great attendance today, so I'm super humbled that everyone's decided to spend their time with us today. Hopefully we'll deliver a really engaging and informative session for you all. I do have a bit of an agenda here that we'll run through. Firstly, I'll give you a bit of an introduction to CoverRight. We'll go through the ABCDs of Medicare, which I think is sort of important for everyone to understand. And then we'll go through the section on, what you don't know about Medicare can hurt you, which I think hopefully will be interesting for participants on the call today. And we intend to do these sessions, like Joseph said, every month going forward. So we will be asking for some feedback throughout the session. And if you just reply to those, that'd be really helpful for us for future sessions. So you guys might be wondering at the beginning, like, who is CoverRight? So CoverRight is a technology startup. We are the first purpose-built digital concierge platform for Medicare. And our mission is very simple. We want to make Medicare as simple, transparent, and accessible as possible for people like yourselves, as well as the 60 million other Medicare recipients in the US. I'm really proud that we've assembled a really passionate team here of innovators who are driven and excited by helping people make the best decision on their healthcare. What does this practically mean? Our platform has previously been dubbed TurboTax for Medicare. The CoverRight platform is 100% free, and it gives you free online educational tools and calculators in order to enable you to find the perfect plan for you. This means you can match your doctors, you can find your drugs, and any extra benefits that you need on our platform, and our platform will spit out the best recommendations based on your inputs. We have a sophisticated recommendation engine that would actually help guide you to the best combination of plans, something that we'll sort of cover today. And, we are here to be your Medicare concierge. When you use CoverRight, you get one dedicated licensed expert from beginning to end. There's no pre-recorded lines, there's no call centers, there's no switchboards. Your agent is your agent. Your dedicated expert is with you the whole way. And if you're lucky, you actually might get myself as your agent. And so I'm excited to work with you. In addition, like I said before, all our services are 100% free. There is never an obligation to enroll, and importantly, we never redirect you or sell your information. And that's it. And so that's about us. And without any further ado, like I'll jump into the session today. So if you are confused about Medicare, you're not the only one. Many of you here today are probably soon to be enrolling or thinking about Medicare. That's why you're here. But on average, every consumer has about 60 options to choose from in Medicare, not including combinations. And it's notoriously complex. So if you're confused, you're not the only one. 73% of people who navigate Medicare.gov are confused by that platform. And 68% of consumers really don't understand what are covered under the various plan options. And so the thing that makes Medicare confusing is that unlike typical healthcare coverage, Medicare is not one single plan. It's divided into a variety of public and private options. And you really do have to select the right combination of coverage for your needs to get what's right for you. And so my goal today is to help you demystify Medicare and make sense of all the ins and outs. So first of all, as many of you know, Medicare is a government-run health insurance program that becomes available to Americans under 65 who have a disability, but most commonly, Americans who are turning 65. There are two sides of Medicare, and we'll start with the left-hand side today, which is the original Medicare program, which is made up of two parts, Part A and Part B, and I'll cover these in more detail on the next slides. And then once you have Part A and Part B, you can enroll in other additional types of coverage, such as prescription drug plans, Medicare Supplement or Medigap plans, or you may have also heard of Medicare Advantage plans, which again, I'll cover today. And so to start off on the original Medicare program. So the original Medicare program, like I said, is made up of two parts. Part A is hospital insurance. And so this covers anything that is inpatient hospital, as well as things like skilled nursing facilities and hospice care. Most people who sign up for Part A when they first turn 65 are eligible for premium-free Part A. You become eligible for premium-free Part A if you paid your Medicare taxes while working for more than 10 years. The main out-of-pocket costs that you have to worry about under original Medicare if you were in Part A is what we call the Part A deductible. It's about a $1,500 deductible that you pay each time you go into inpatient care at a hospital. It covers the first 60 days of your care. And then after that, you have to pay a per day copay for days 61 plus. And so that's the key cost in relation to Medicare Part A. Medicare Part B is medical insurance. So Part A covers inpatient hospital, Part B covers outpatient, basically, is the way to think about it. So medical insurance includes things like the doctor visits, ambulance trips, medical equipment. The cost of Part B in 2022 starts at $170 per month. This can scale up depending on your income, but the standard premium is $170 per month. In order to have Part B, there is a $233 deductible each year. This means you have to pay $233 out of pocket first before Part B insurance will kick in. When Part B insurance does kick in, the insurance will cover 80% of your costs, which means that you will have to pay 20% of the cost of healthcare services that are covered under Part B. And that is uncapped each year. The next item is Part D, which many of you might have heard of before. That is prescription drug coverage. There are two ways to get prescription drug coverage. One is to buy a standalone plan, which is what I'll be explaining right now. If you're buying a standalone drug plan, the average premium of a prescription drug plan is between $7 to $99. And the key out-of-pocket costs are a deductible, which ranges up to $480, and fixed copays and co-insurances for your drugs. And so what that means is when you go to get your prescriptions each month, there is a copay that you have to pay. The copay is determined by the tier of your drug. So each plan will tier drugs in what's called a formulary. They'll say, you know, drug A is a tier 1 drug, drug B is a tier 2 drug. As the tiers increases, the copays and co-insurance increases. What's important to note is drugs are covered very differently between different Medicare Part D plans. So it's very important to check the prices before you enroll in a plan. We've seen in certain instances within the same zip code, 2 plans where the price of a drug was, there was a 2-3x difference in terms of the price of that drug across 2 different plans for the same drug. The next the next private coverage that you can buy if you are on original Medicare is Medicare Supplement plans. Medicare Supplement plans are also known as Medigap insurance and are policies sold by private insurance companies that are designed to help pay for the out-of-pocket healthcare costs that are not covered under original Medicare Part A and B. And so what that means is it will cover that $1,500 deductible for the Part A hospital stay, and it will cover the 20% co-insurance for the doctor visits and the outpatient coverage that you get under Part B. There are officially 10 different types of Medicare supplement plans, which unfortunately makes it more confusing. They all have their own letter designation. However, the majority of new Medicare beneficiaries who purchase a Medigap plan will select what's called a Plan G or a Plan N. Those plans typically have a premium of between $90 to $300, and that's dependent on your age as well as your location. And with a Medigap plan, it's typically understood as, you know, Cadillac coverage, which means it covers all your out-of-pocket costs. The only cost you have to pay is to that $233 Part B deductible. And so the benefit of a Medicare supplement plan is you pay an extra premium, and then you really don't have to worry about any healthcare costs, with the exception of the $233 deductible each year. So we just really covered the left-hand side of the page, which is original Medicare Part A and B. With that, you can purchase your Part D standalone drug plan, and as well as purchase a Medicare supplement gap coverage plan. The other alternate way to get your Medicare coverage is on the right-hand side here, and it's called Medicare Advantage, also known as Part C. Medicare Advantage plans have grown in popularity in recent years, and so I'm going to step through what the differences are and how it compares to staying in the original Medicare program. So what is a Medicare Advantage plan? Medicare Advantage plans are an all-in-one bundled alternative to original Medicare. They are also offered by private health insurance companies. Those private health insurance companies may offer a Medicare Advantage plan. They sometimes also offer Medicare supplement plans. So you'll see the same companies offering different types of plans. But a Medicare Advantage plan bundles Part A and B, and usually Part D drug coverage. And it will often also come with extra benefits such as dental, vision, and hearing, which are not covered under the default government original Medicare program. What's important to note is Medicare Advantage plans come with doctor networks. So if you've ever heard of the concept of the HMO or PPO plan from your group insurance, those concepts apply for a Medicare Advantage plan. In addition, when you're picking a Medicare Advantage plan, what you are actively doing is you are deciding to take your Medicare coverage from the private insurance provider rather than directly from the government. What that means is the federal government pays your plan to deliver you Medicare. And that's why there's doctor networks, because that plan gets to determine which doctors you can go to. So what are the features of a Medicare Advantage plan? Medicare Advantage premiums are typically range from $0 to $100 per month. However, 60% or the majority of Medicare Advantage plans have a $0 premium. What that means is it's $0 in addition to your Medicare Part B premium. So if you recall earlier, there was $170 for your Part B. You have to pay that Part B regardless of if you stay in the original Medicare program or if you go into Medicare Advantage. The Medicare Advantage premium itself is $0 to $100, and most of them are $0 premium plans. In terms of key out-of-pocket costs, Medicare Advantage plans have deductibles of $0 to $1,000, although a lot of the plans have $0 deductibles. Instead of paying a 20% co-insurance to see your doctor and for outpatient services, they typically have a list of costs. So each plan will list out the costs for different services. It's like a menu of options, and they'll have specific costs. That will replace that 20% co-insurance. And so, for example, your plan might say it's $0 to see your primary care doctor and it's $25 to see your specialist. The plan might also say it's $250 per day for the first few days of your stay in a hospital, and then the plan will cover the rest up to 90 days. And so each plan is different, and those costs replace what the original Medicare costs are, again, because the plan is delivering you the care, and so they get to determine what those co-pays and co-insurances are that you have to pay, as well as the doctor network. Every single Medicare Advantage plan has a maximum out-of-pocket cap. A maximum out-of-pocket cap is the maximum amount you have to pay out-of-pocket for Medicare covered healthcare services each year. So if you have a year where you have an accident, there's some catastrophic coverage. Once you hit, for example, the maximum cap is $3,000. Once you hit that $3,000, the plan pays for the rest of your Medicare covered healthcare costs for the remainder of the year. The maximum cap ranges depending on where you live, depending on the type of plan you have. And so that's a consideration. So we've covered a lot just then, and I wanted to just summarize, again, that sort of left-hand side option with the right-hand side option that we've been speaking about earlier. The left-hand side being you're staying in original Medicare, so the government program, and you're buying a Medicare Supplement plan to help cover the gaps that original Medicare doesn't cover. The right-hand side being the Medicare Advantage plans that we just spoke about. So in terms of benefits pros and cons, if you stay in Medicare Supplement, original Medicare with a Medicare Supplement plan, there are no doctor networks. This is because you're staying in the original government program. So you can go to any doctor that accepts Medicare, which is why a lot of people who decide to stay in original Medicare want that option. Like I said earlier, for Medicare Advantage plans, there are typically doctor networks. Some plans allow you to go out of network, but will charge you a higher cost if you do go out of network. The second benefit of being in original Medicare and having Medicare Supplement plans is there's limited to no out-of-pocket costs. Like I was saying earlier, when you purchase a Medicare Supplement plan, you're paying a premium each month. And the plan will cover the gaps in your costs. So that 20% co-insurance, the $1,500 Part A deductible, the plan covers those. So you basically don't have to worry about out-of-pocket costs when you go and use healthcare services. In contrast to that, for a Medicare Advantage plan, you pay as you go. So we spoke a little bit about, doctor co-pays, hospital co-pays. The plan makes you pay those co-insurances and co-pays as you go, up to the maximum out-of-pocket limit. And so that's the downside of being in Medicare Advantage. In terms of the downside of being in a Medicare Supplement plan, it's you have higher premiums. So to get that comprehensive coverage that I mentioned earlier with limited to no out-of-pocket costs, you have to continue to pay a monthly premium in the range of $90 to $300 plus, depending on where you live, your age, and location. The benefit of a Medicare Advantage plan is a lot of them have $0 premiums. And so the reason they are $0 premiums is because you're sharing costs and you're paying as you go for healthcare services during the year. And the last point here, when you stay in the original Medicare program with a Medicare Supplement plan, there are no extra benefits. So you will have to buy a separate drug plan. You have to buy, dental, vision, and hearing coverage if you want that. A lot of Medicare Advantage plans, which you probably see advertised on TV, come with dental, drug, vision bundled into the plan. They give you some level of coverage there, and so if those benefits are important to you, you kind of have to decide whether you want that through the Advantage plan or you want to buy that separately. But the staying in the original Medicare option does not cover those. So that's really it. That's like the ABCDs of Medicare. And I think the important point to note here is that Medicare is not one size fits all. Some people are better suited to a Medicare Advantage plan. Some people are better suited to staying in original Medicare with Medicare Supplement. It depends on a number of factors, including like your health condition, maybe what drugs you're taking, what your personal financial budget is when it comes to monthly premiums and things like that. And so there's no, one's better than the other. It's always a case-by-case decision. So moving on to, what this session was about, having covered Medicare 101, the next section we wanted to cover is really, what you don't know about Medicare can hurt you. And so what we want to cover is some of the common things that people don't know that can come back and bite them down the road. And the first one here is that your enrollment periods matter. So when it comes to Medicare, there are fixed enrollment periods for which you can enroll into and out of Medicare plans. There are two major ones that you need to be aware of, and probably most relevant for this audience. One is your initial enrollment period. Your initial enrollment period is a 7-month period around your birthday that starts 3 months before your birthday, includes the month of your birthday, and ends 3 months after the month of your birthday. During this period, this is the first time when you turn 65 that you can enroll in original Medicare, as well as select a drug plan or Medicare Advantage plan. So it's an important period, and I'll tell you why it's important, because there's consequences for missing that. The second most important sort of special enrollment period, again, for this audience is probably someone who's retired. So you've worked past your 65th birthday, you've retained group insurance coverage. If you're in that position, you have special enrollment periods that allow you to go into a Medicare plan. There's two ones that you need to know. One is how to get into original Medicare Part B. For that, you have an 8-month period after you finish work to get into a plan. But the next one is probably more important. You only have a 60-day window when you retire to find a drug plan or Medicare Advantage plan. And so in most cases, what we tell our clients is ignore the 8-month rule. You really should be looking at that 60 days and making sure that all your coverage is in place by the end of that period. So why is it so important that enrollment periods are adhered to? The major reason is there are late enrollment penalties. Late enrollment penalties are the penalties that the government gives out when someone doesn't enroll in Medicare on time. Now, the reason for them is obviously the government does not want people to basically free ride. And so basically not pay premiums when they're healthy, and then when they're not healthy, enroll in Medicare and then get the coverage. And so what they need is for everyone who's turning 65 to be paying their premiums. The penalty for enrolling in Part B, which is again that medical outpatient coverage, is 10% of the standard premium for each 12-month period that you missed signing up for Medicare. So if you missed it for 2 years, then it's 20%. If you missed it for 3 years, then it's 30%. And the most important thing to note is that these penalties are lifelong penalties. They stay for as long as you have Part B, which for most people is for the remainder of their lives. There is also a penalty for not having drug coverage. And so a lot of people who are retiring or had drug coverage before and now going to Medicare don't know that you need to have a Part have drug coverage or a Part D drug plan, even if you don't take any prescription drugs. The penalty for not having a Part D plan is about 1% of what's called the national base beneficiary premium, which is $33, multiplied by the full number of months you had no coverage. And this can add up. We've seen people who just forgotten about it for 8 to 10 years, and the number gets really big. And so it's important to have that drug plan when you're retiring as well. You can't skip out on having a prescription drug plan, even if you are healthy, even if you're not taking any prescription drugs. Now, we mentioned earlier that the initial enrollment period is one of the most important periods, and you'll see why when I talk about it shortly. So what happens if your initial enrollment period ends in June? In other words, your birthday is in March, and your initial enrollment period ends June 30, 2022. So if you miss that enrollment period for original Medicare A and B, the next time you can enroll in original Medicare A and B is the first quarter of the next calendar year, January 1 to March 31. It's called the general enrollment period. When you enroll during that period, your start date is July 1 of that year. So what that means is if you miss your IEP which was June 30, and you enrolled in Jan, you don't start coverage until July 1. So you actually have a gap in your health coverage of 12 months, of which you need to find some other sort of coverage between that time. Not only that, if you miss your initial enrollment period, there is a late enrollment penalty. We just spoke about those. For Part B, it's 10% for every 12 months. So for someone in this position, they've just exactly missed 12 months of coverage. So there's a 10% penalty. There is also a penalty for each month there is no drug coverage. So that is why your enrollment periods really matter when it comes to Medicare. You must get ahead of it and make sure you have the right coverage in place. And we always recommend that you start doing that at least 3 months before, but ideally 3 to 6 months before your 65th birthday, so you can just make sure everything's in place. So when can you actually defer coverage and avoid the penalty? So Medicare only allows you to defer your enrollment if it is creditable coverage. And so the only two exceptions for creditable coverage are if you're working and your employer has more than 20 employees, in which case you can defer Medicare. And for the drug portion, if your drug plan from your company is as good as Medicare's. And so if your company drug plan is not as good as Medicare's, you also need to get a Part D drug plan if you're over 65. Otherwise, you'll get a penalty. But more importantly, if you're in any of these situations, you're currently on COBRA, you're on retiree insurance, you're on a ACA plan or Obamacare plan, you're on short-term insurance, or you have VA or TRICARE, you need to at least enroll in the original Medicare A and B. The next biggest piece of information that people don't know that can hurt them relates to the Medicare Supplement plan. And so earlier today, we went through what a Medicare Supplement plan is, and that's the plan that works with the original Medicare program that gives you comprehensive coverage. You pay a $90 to $300 premium and you have limited to zero out-of-pocket costs. In most states, you only have one chance to enroll in a Medicare Supplement plan without health questions. And that one chance is the 6-month period after you first enroll in Part B Medicare. So for most people, this is when you turn 65 and you're going to Medicare, but this could be later if you're retiring and you deferred Medicare. But basically the first time you enroll in Part B, that opens up a 6-month window where you can buy a Medicare Supplement plan with no underwriting and no health questions. And the benefit of that is that they can't charge you a different price. They have to accept you. If you miss this period and you try and apply for Medicare Supplement in the future, the carrier can ask you health questions and they can also deny you coverage. And so you actually might not be able to get a Medicare Supplement plan down the road. which is okay if you're healthy. But if your health condition worsens and you finally decide you want to get a Medicare supplement plan, then you'll have to go through underwriting and health questions. So that's it. We've gone through a lot of content today. I hope that's been informative, and happy to answer any questions. And I know, Joseph, you're probably organizing that as we speak. Those 3 or 4 items that we just went through in terms of what can hurt you are really important. And I'd be happy to answer any additional questions you might have on that.
Thanks, Rich. That was a lot of amazing information. So let's get to the Q&A. We have some questions already, but Katie, we'll start with her question. Is there an application process to defer starting coverage, or can you just provide proof of insurance as a credible source?
Yes. So there's no application to defer coverage. You basically just need to provide proof, as you say, when you actually enroll into Medicare.
Okay. So you brought it up, Richard, so I'm going to just jump on it. There's no such thing as a free lunch. You talked about those commercials with the 0 premium plans. They feel a bit scammy, but I know they have some good coverage. If someone doesn't want to get stuck in the wrong plan, like how do you evaluate those? How do you know that you're dealing with legitimate coverage?
And so just to clarify again, that just so in terms of legitimate coverage, you mean
like the commercials just feel a little less than legit.
Yeah. Okay. Yeah. I mean, the Medicare Advantage plans are becoming more popular, and the reason for that is because those plans, a lot of the thing that attracts a lot of people to them is that a lot of them are $0 premium, and you do get the dental, vision, and hearing coverage, and so those things are true. If you hear those ads on TV, they're correct. The thing that you have to really be aware of when you're making that decision really is what's your preference for taking on healthcare costs? Because under a Medicare Advantage plan, you basically have to share costs up to a maximum out-of-pocket cap, which could be in the range of $3,000 to $11,000, and so it can get quite high. And you have to make that decision in contrast to staying in the original Medicare program and getting a Medicare Supplement plan, which might cost $90 a month. So, which could end up being cheaper for you throughout the year. And so it really depends on your own situation. The Medicare Advantage plans aren't necessarily bad; they are advertised for, and there is a reason for that because all the plans do want to sell those. So you should expect that, but they're not necessarily bad. You just have to make sure it's right for your situation.
So you mentioned dental and vision not being covered by Medicare, but some Advantage plans do cover it. What does someone need to do if they want dental or vision and they choose a supplement plus original?
Yeah, it's not too dissimilar as when you're in group insurance coverage. You really just have to go buy a separate dental and vision plan, and there are a lot of providers out there that provide that. And so when you're doing the math and the calculation and you do want dental and vision, like that is an extra premium that you just have to be ready to pay for.
Great. A couple more questions here. Gloria asks, I plan on signing up for an Advantage plan. I still need B and D?
Good question. So regardless of if you are in original Medicare or if you are in Medicare Advantage, you need to have your Medicare Part B. So you can't get out of not having that. So you will need to be paying that $170 per month standard premium for the Part B, regardless of if you're in Medicare Advantage or Medicare Supplement. So the answer is yes, you do need your Part B if you're going into a Medicare Advantage plan.
And if they're signing up with a Medicare Advantage plan, they take care of the enrollment with the government because the government's paying them directly. Is that correct?
No, you actually have to enroll in the underlying original Medicare program first, and then a service like ours, like CoverRight, then we can help you find the right Medicare Advantage plan. But for us to enroll you in that Medicare Advantage plan, you do need to first have your A and B and your red, white, and blue Medicare card with your Medicare number.
That's an important note, right? So before you can enroll in Advantage or Supplement, you need to sign up with the government for A and B.
Yeah, yeah. And there was a second part to that question. Do you need to sign up for D? So a lot of the Medicare Advantage plans have D bundled within the plan. And so the answer is yes, you need to sign up for D, but D typically comes with the plan and no additional premium.
So Brian asks about initially signing up for Medicare Advantage. Is there an underwriting for health?
Yeah, that's a great question, actually. So like I said, when I was explaining earlier on Medicare Advantage, when you choose Medicare Advantage, you're basically choosing to take your healthcare, your Medicare through a private plan rather than directly from the government. But what actually ultimately happens is the government is paying that plan to deliver you Medicare. And so on the Medicare Advantage side, they cannot deny you coverage. If you are eligible for Medicare, you have your Medicare Part A and B, you can sign up to a Medicare Advantage plan because that is an alternate coverage that you're deciding to take for instead of original Medicare. So they have to accept you. That's different from the Medicare Supplement plan, which is true private coverage. The government doesn't pay anything into that. That's you buying it directly from an insurance company, similar to your home insurance, similar to your auto insurance. And so that's why on the Medicare Supplement side, they can underwrite you and deny you coverage.
So this question here I have is a little bit of a summary, but maybe it'll help some of our listeners. There seems to be a lot of areas where I can mess up enrollment in Medicare. Can you clarify the key things I need to do or not miss in this important time?
Yeah. I think the key one for most people is really understanding that enrollment period when you're turning 65 or if you're leaving work. So to remind everyone again, your initial enrollment period is a 7-month period around your 65th birthday. During that period, you should sign up for your A and B, and you can select a private plan during that period as well. And so it's important to do it within that 7-month period. We always recommend you do it before your 65th birthday if you want the coverage to start that month. And the second one, like I said, is if you're leaving group insurance coverage, there's two things there. One is to make sure that if you decide to stay and work and use your company's health insurance, that you are eligible to defer. And the eligibility, like I said earlier, is you can defer Part B if your company has more than 20 people in the company. That's number one. And so if you can defer and when you're leaving your work, we'll post this webinar online, but there were 2 periods. The most important one, and I'd say to everyone, is make sure you get all your coverage in place within 60 days of leaving work. Within 60 days, that's the most important number. So within 2 months, have your original Medicare, and if you want a private plan, have that in place before the end of those 60 days.
So Richard, we've been talking a lot about months, 7 months, month of your birthday, etc. Does it matter if my birthday is April 25th, if I sign up by April 30th, April 1st, May 30th? Is there a better, best situation there?
Yeah. The way most Medicare coverage works is it starts on the 1st of the month. And so if you're turning 65 and you're going into this decision, and you want your Medicare coverage to start the 1st of the month of your birthday, for example, my birthday is April 29, and I want the coverage to start April 1, then you should have everything done. Ideally, no later than mid-March, but you got to remember there's a reverse timeline. So you have to get your A and B first, and then you can enroll into a private plan. And so if you're intending to do both, it's best to get your A and B as early as you can, which means you basically go to Social Security, you go, I want my Medicare coverage to start the 1st of the month of my birthday, send me my Medicare card, and you basically will get that. And then once you have that, we can help you enroll in a private plan ahead of your birthday month.
So I know you probably don't have an exact answer for this, but as you were just describing that, I was wondering, how long does it take the government to issue the Medicare card?
It ranges, and we've seen it range, particularly through the COVID period. But I'd say typically if you apply for it, it takes about 3 weeks or so for them to get back to you. If you're already on Social Security, at least sort of 4 months before your 65th birthday, so you've been on Social Security when you're 64, for example, then the government actually automatically sends you that card in that 3-month period before you turn 65. So you don't actually have to proactively apply for it. But if you do proactively apply for it, it's typically around 3 weeks that we've seen.
Excellent. So keeping that in mind when you back out your dates, because that's part of that 7-month window, right?
Yeah, that's right.
Well, I appreciate all the insight, Richard. Obviously, there's a lot of dates, and everyone's going to have their own specific birthday, birth month, and the nuances of their medical history. So we're here to help. But I want to thank you for the presentation. You covered a lot. Thank everyone who joined us today. It's appreciate you spending some time with the CoverRight team. We will send an email with a link to the recording, so you can listen to it again. You can always check out our Learning Center where there's a lot more information. It's learning.coverright.com. And our team is always available to help answer questions, work with you on a personalized plan, answer specific questions related to your situation. And you can reach out to them at hello@CoverRight, or just visit our website and hit the Get Started button. Invite everyone to join us next month when we will be talking about time is not on your side, how to make an informed Medicare decision. So until then, visit our website, take advantage of everything we have to offer, and we will see you all soon. Thank you again.
Thanks, everyone.
I'll launch a quick poll if it's still around.